And here you see a beautiful view of the ice cream cone again, as it will appear on the CT scan. And this is the fossa incudis, which is going to be pointing to the patient now. And I think Satish will be demonstrating all that very elegantly in the temporal board. As I've seen in the section, he's the master. And all this I'm presenting actually, I've always been a rhinologist, but 2 years ago, when I saw one of his dissections on the temporal bone, it stimulated me to learn more about the temporal. And being a skull-based surgeon, I think you can't just limit yourself to just knowing the anatomy of the paranasal sinuses or the infratem. You have to know everything. You have to know the anterior cranial fossa, you have to know the temporal bone, you have to know the jug. So you have to know it all. That's when you can maybe, and then of course have the relevant skills, but you need to know the anatomy, every single millimeter of the skull base, you need to be familiar with that anatomy. So now we're going on to the posterior surface, and this is a beautiful view of the posterior surface of the petrous, petrous part of the temporal bone. And here you can see this is the IAM, internal acoustic meters, and below that this is the jugular foramen. That's the nervous pars nervosa, and this is the pars vascularis, and this is the ninth nerve, the 10th nerve coming out here, and this is the jugular tubercle, and below that would be the 12th nerve right here. Running in the petroclival fissure is the inferior petrosal sinus, and which opens into the pars nervosa, and this is the superior petrosal sinus, which ends up in the sigmoid sinus and drains into the jugular foramen. Here, very nicely dissected is the petrous apex. What are the contents of the petrous apex? Well, you can start off with the petroclinal ligament right here, through which the here beautiful view of the Dorellus canal. You remember I showed you a slide where it's exiting from the Dorellus canal. Well, here is a slide where it's entering the Dorellus canal. This is the sixth nerve. It enters here and exits here up there as a sixth nerve, and it will be always medial to the V1. And that is the Meckel's cave, would be right here. This is the fifth cranial nerve, and up here, this is the third cranial nerve. And see the contents of the petrous part of petrous apex, rather, I would say, are the Meckel's cave, the petrous carotid artery, the petroclinal ligament here. These are the landmarks, basically, are in the petrous apex. Okay, and so let me go on to the next slide here. This is when everything has been stripped off. This is what you see. So let me see, what is this here? Anyone can tell me? This is where the endolymphatic sac opens here. At the opening, actually, this is not entire opening here. The opening is always about 2 millimeters or so, and but it has a wide, the bony aperture is quite wide because it's a sac. It's not really a single opening, it's a sac. So what is this? This is the jugular tubercle. Now the 9th, 10th, and 11th nerve will pass through here. And what is this below this here? That is the hypoglossal canal. So when you're looking at the CT scan, you always see the jugular foramen first, and the jugular tubercle, and only inferior to that, you see the hypoglossal canal. And what is this? This is the occipitomastoid suture line. And this we have already talked about it, occipital suture, and that is the foramen ovale, and this is the foramen spinosa. Now, this is actually let's look at the internal acoustic meter. This is a picture, a short video I took of the skull that I have in my clinic. And you can see this is the left side. And nice view, even this skull is almost, I think, 40 years old. I had this for such a long time. You can see everything here. This is the facial canal, this is where the facial nerve would be. This is where the cochlear nerve will be. And this is the left side, mind you. So this is anterior, this is posterior. So this is the superior SVN, the superficial vestibular nerve. This is the inferior vestibular nerve. And what is this foramen right here? That is the nerve for the singular nerve. Okay. So this and it sorry, let me go into. And this was taken from Professor Roton. And this is the right side. And here you see this is the anterior part, 7th nerve, cochlear, and cochlear nerve inferiorly. This is the horizontal crest, vertical crest, superior vestibular nerve, inferior vestibular nerve, and the singular nerve. Okay, so let's go on to the next slide here. So why do I show this slide? Well, this is the route of entry of the seventh nerve of the seventh and eighth nerve from, and the highlighted here is the arcuate artery. Now, this arcuate artery is a branch of the labyrinth artery. Labyrinth artery in turn is a branch of the ICA. And the reason I show it because this is the artery that emerges in the runs through the subarcuate canal below the superior semicircular canal. So here the IAM has been nicely dissected, beautiful dissection. And although this part is going to be wider, but a wider dissection has been done here to show the anatomy. Here you see all the structures. The nerve that has been highlighted here is the superior vestibular nerve. Here is the Bill's bar or the vertical crest. This is the facial nerve. And what is this nerve right here? That is the nervus intermedius. So this would be below there. It is the cochlear nerve, and inferiorly here would also be the inferior vestibular nerve, which you don't see it very clearly on this, but you see the owl. And this is the labyrinth artery. Sometimes the labyrinth artery can prolapse right inside the IAM. And this nerve we have talked about is the nervus intermedius. I'm not going to talk about what, how is it formed and all that will come later. Maybe Satish will talk about that later. So this is a different view, a different perspective of the internal acoustic meter. You can see this is anterior because the cochlea is anterior. This is the vertical crest, horizontal crest, superior vestibular nerve, vestibule, facial nerve, inferior vestibular nerve, cochlear nerve right here. And here you can see the cochlea has 2.5 tons. It's roughly about 30 to 35 millimeters long. And you see this is the modulus, the spider crest, and the modulus in the center right here. And this is the osseous crest right here. I think Satish, this is Satish's favorite subject, so I'm not going to steal the thunder from him. But again, you see a beautiful relationship of the GSPN, the cochlea right here with the labyrinth part of the facial nerve. And so let me go on to the next slide here. And right here, that may be the singular nerve, which is going into the foramen right here. And what is this? We talked about it just now. So this is the posterior semicircular canal. And if you're going to look for the endolymphatic sac, it's going to be right down there. So let's go back and see what is this structure called. It is called the operculum. This is where the endolymphatic sac emerges. And here we are. It has been dissected out beautifully. This is the posterior semicircular canal. This is the crus commune, and exactly how this will appear on the CT scan. This is amazing. This is almost like you can superimpose it on the CT scan. This is the arcuate eminence right here. So this is the crus commune, and this is the posterior semicircular canal, which is going inferior, hugging around the lateral semicircular canal, and this is the endolymphatic sac. You notice close relationship with the jugular fossa. So let's go back here. We talked about the rest of things. Ready? Now, what does this is again, once again, going up to the petrous apex. Beautiful demonstration of the internal petrous part of the carotid artery. Like Satish mentioned, it enters here, it has a short vertical segment, then has a genu, and comes in right here, and another genu here, it goes up here. Okay, this is beautiful demonstration. And these are the contents of the petrous part of the temporal bone. This is the look at the cavum trigeminal, fifth nerve cavum, as we call it. And this is the sixth nerve, and this is the fourth nerve right here. The sixth nerve, as it comes out to the Dorellus canal. We already talked about the internal acoustic meters here, superior petrosal sinus, inferior petrosal sinus. And note here how the inferior petrosal sinus is coming out and ends in the pars nervosa right here. And that is the pars vascularis of the jugular foramen. And this is the top is the sixth nerve, and this is the now this is a very nice slide which I love here, and you can see all the openings of the semicircular canals here, and this is the sacule. The steel thing here is the ampullary end of the superior semicircular canal coming here. This is the posterior semicircular canal here, and this common opening between the non-ampullary ends of the superior and the posterior semicircular canal. So this would be the crus commune, and this is the lateral semicircular canal, which combines with the ampullary end of the superior semicircular canal, and that is the forming the vestibule, and it has own only non-ampullary end opens separately right here. Probably the only semicircular canal to have a lone non-ampullary end opening in the vestibule. But what is this structure right here? Anyone? Well, I think that is the probe of the vestibular aqueduct. Okay, and so in all there are about 7 openings in the vestibule. So let's come to the IAM here. You have, this is the superior vestibular nerve, the facial nerve. This would be the inferior vestibular nerve here. But what is this nerve coming right here and ending up right here at the ampullary end of the that is the singular nerve. We will be able to see that all the structures that I'm just talking about here, we should be able to see them on the CT scan. Sorry, let me go back here. So coming down to the jugular fossa, again, a very brief, this is the pars nervosa. As you see here, the 9th nerve passes through here. This is the pars vascularis, the 9th and the 10th nerve are passing through here. The jugular foramen has been dissected, and here you see the 9th nerve, the 10th nerve, and the 11th nerve right here. And below this, the jugular tubercle. Below that is the hypoglossal canal. Again, more dissection here. The condylar canal has been, the hypoglossal canal has been opened. But what I want to show here is the 9th nerve here, and this is the 10th nerve. And there are 2 small nerves here, this here, which is running vertically through the carotid canaliculus, and that is the tympanic branch of the 9th nerve. And here is another branch running horizontally from the vagus, and that is the auricular branch of the vagus nerve, also called the Karnal's nerve, and this is called the Jacobson's nerve. So here, this is the lateral view. You can see beautifully. This is the 9th nerve, and this is the Jacobson's nerve going here, and this is the 9th and the 10th nerves right here, and this is the 12th nerve to the tympanic nerve. And this probably this is the Arnold's auricular branch of the vagus nerve here. That is the Jacobson's. So coming down to the inferior surface very quickly, and this is some of the structures we talked about just now when Satish was doing the dissection. We talked about how the eustachian tube protects the carotid artery. Well, here you have a small picture. Look at that. You know, it is basically, if you're coming from here, it is protecting it. And this is the internal carotid artery entering the carotid canal. It's a small vertical segment, then it becomes petrous. And then here you can see the GSPN very nicely. And this collects some fibers from the carotid canal. And this is the median nerve and becomes the median canal. This is the foramen ovale right here. And Satish talked about which is the horizontal nerve of in this area. So this is the auriculotemporal nerve. You can see here. It sometimes engulfs or goes around the middle laryngeal artery, and it will run transversely across behind the condyle and then into the parotid gland. It also carries the postganglionic fibers of the salivary gland. Again, that's what we talked about. The arrow here points to the styloid foramen. It's the styloid process. And this styloid, this is the facial nerve. And once again, this is the mastoid process, 4 muscles attached to it. I won't go into that. So let's go from here. Have you missed anything? Inferior petrosal sinus coming here. And this is the condylar canal that's open, jugular fossa right here. And this is the condyle. Anybody been to Bali? No. Okay. I'm not a fan of the mnemonics that we have, but one mnemonic I always remember is Bali, because Bali is my favorite destination. Yes.
Yes, boss. Continue.
Yeah. So the branches of the of this V3 is the buccal, is the auriculotemporal, lingual, and inferior alveolar, leaving the muscular branches aside. So let me just go very quickly to the lateral surface. And here you see the sigmoid sinus, the sinodural angle. Again, the real sinodural angle is between the superior petrosal sinus and the sigmoid sinus right here. And if you're going to look at the CT scans from the lateral perspective, you see the lateral semicircular canal and the posterior semicircular canal before you can see the superior semicircular canal. and this is the lateral posterior and the lateral semicircular canal. See a beautiful view of the crus commune here. This is the posterior semicircular canal, superior semicircular and crus commune here, the lateral semicircular canal. We have a nice view of the incus and of the stapes, porta tympani, and right here is the stapes, the pyramidal eminence, the superior tendon, and this is the porta tympani here. This is the mesotympanum. Anything about this line from the sputum going on to the facial nerve, about this is the epitympanum, and in the middle here is the mesotympanum. Below this is the hypotympanum. So this is the facial recess. We'll talk about that on the CT scan, and this is the endolymphatic sac. So this is the last slide before I go on to the second part that shows you the porta tympani. Porta tympani actually basically takes off about just a few millimeters before the stylomastoid foramen. Then it runs in the canal itself, and then it emerges into the middle ear, very near the where the stapes is. So we are not able to identify the